Tactile hallucinations. A tactile hallucination is an abnormal or false sensation of touch or perception of movement on the skin, under the skin, or inside the body. The hallucination might range from a strange feeling of something brushing your leg, like the swish of a dog's tail, where no dog is there, to something quite substantial and with real substance, like that recounted by Dr. Mino Judson Savage, the American Unitarian minister, poet, psychical researcher, and author. Dr. M.J. Savage, Psychics, Facts and Theories. On another occasion, I was sitting with a medium. I was too far away for him to reach me, even had he tried, which he did not do, for he sat perfectly quiet. My knees were not under the table, but were where I could see them plainly. Suddenly, my right knee was grasped, as by a hand. It was a firm grip. I could feel the print and pressure of all the fingers. I said not a word of the strange sensation, but quietly put my right hand down and clasped my knee, in order to see if I could feel anything on my hand. At once, I felt what seemed like the most delicate fingertips playing over my own fingers and gradually rising in their touches towards my wrist. When this was reached, I felt a series of clear, distinct, and definite pats, as though made by a hand of fleshy vigour. I made no motion to indicate what was going on, and said not a word until the sensation had passed. All this while I was carefully watching my hand, for it was plain daylight, and all was in full view. But I saw nothing. Rather sadly, tactile hallucinations are rarely pleasant. Sometimes they are excruciatingly painful and unpleasant. Examples of tactile hallucinations include the feeling of bugs crawling on the skin, internal organs moving around, or stinging of the skin. Formication. Whilst the word fornication with an N is used to describe immoral sexual intercourse between two people not married to each other, formication with an M, not N, is defined as an hallucination of ants or other insects creeping on or under the skin. The word comes from the Latin formicare, meaning to creep like an ant. It is a truly horrible feeling. This is a post from a site that helps people with ADHD, attention deficit hyperactive disorder, and ADD, attention deficit disorder. From the forum Totally ADD by Ginny Bean, May the 4th, 2012 at 2:15 a.m. I was taking Dexedrine and then Ritalin for my ADHD. I developed very bad formication, and unfortunately the doctors I saw could not tell me what the problem was. After a while I was told I am psychotic and needed antipsychotic meds. The formication was less on Ritalin And I finally figured out what the problem was when I ran out of my Ritalin prescription and took some of my leftover Dexedrine. Within 2 days, I had extreme crawling sensations. I quit taking meds. I was so traumatized by dealing with this for almost a year with no solution. I did refuse the antipsychotics as they turned me into a zombie. It is known that ADHD is caused by a poor diet, high in sugar, which causes the hyperactivity. The soft drinks full of sugar, the sweets, cakes, crisps and snacks. And boys like to exercise to get rid of all this energy. Not sit in a classroom all day, listening to a teacher who may not be all that good. And so do girls really, but they tend to be better at making the most of a bad job. So to stop the formications caused by the pharmaceuticals, change the diet to have less sugar and more fresh fruit and vegetables. Formication and medicines. Legal pharmaceuticals. The eHealthMe site collects the records of symptoms and adverse drug reports submitted by doctors to the FDA. The United States Food and Drug Administration, a federal agency of the Department of Health and Human Services, and formication is one of the symptoms they monitor. And it is clear from the statistics eHealthMe have collected that legally prescribed pharmaceuticals are a major cause of formication. Bearing in mind that these statistics were only collected in the USA and only recorded by doctors and not patients, the figures they supply are quite alarming. By July 2023, they had 7,598 people who had experienced formication. They had even found 61 people reporting formication after having had the Johnson COVID vaccine. 199 people had experienced formication after having had the Pfizer vaccine, and 189 people had experienced formication from the Moderna vaccine, and they calculated that 1,423 pharmaceuticals, medicines, had resulted in formication. If we use the eHealthMe figures and charts, the link is provided in the description to the video. A full list of pharmaceuticals that have caused formication can be obtained. If we then take only the pharmaceuticals that have caused over 50 hallucinations, we find these classes of pharmaceuticals. Antipsychotics like Abilify, quetiapine, Seroquel. Antidepressants, duloxetine, Cymbalta, venlafaxine, Effexor, fluoxetine, Prozac, escitalopram, Lexapro and Cipralex, mirtazapine, Remeron, paroxetine, Paxil and Seroxat, sertraline, Lustral, Zoloft, Buprion, Wellbutrin. Inhalers, bronchodilators, Ventolin, Salbutamol, Albuterol, Montelukast, Singulair, Tiotropium bromide, Spiriva, used to open up the medium and large airways in the lungs. Benzodiazepines, Alprazolam, Xanax, Diazepam and Valium, Lorazepam, Ativan, Clonazepam, Escitalopram, Clonazepam, Klonopin, Rivotril, among others. sleeping pills, zolpidem, Ambien. Antihypertensives, amlodipine, Norvasc. Calcium channel blockers, valsartan, Diovan, losartan, Cozar. Angiotensin II receptor blockers, lisinopril, Zestril. Angiotensin converting enzyme inhibitors. Aspirin. Aspirin contains salicylate, a compound found in plants such as the willow tree and myrtle. Its use was first recorded around 4,000 years ago. Hippocrates used willow bark for relieving pain and fevers. eHealthMe found that 257 people had formication. This is quite high. So why? Some drug interactions can occur when aspirin is given with other medicines, and it may be the interactions. Aspirin sensitivity can cause acute urticaria in some individuals. Urticaria or hives is a skin reaction that causes itchy welts and could be confused with formication. Finally, an aspirin tablet contains a small amount of aspirin, usually 300 to 400 milligrams, in a starch binder, and sometimes contains other ingredients like caffeine and buffers. Maybe it is the starch, or the caffeine, or the buffers that are actually causing the formication. But in the end, we have to admit, without the case histories, we do not know. Paracetamol, Tylenol and Panadol, Vicodin, hydrocodone, paracetamol. Beta blockers, atenolol. Multiple sclerosis medication, Avonex, Tecfidera, natalizumab, Tizabri. Muscle relaxants, baclofen, Flexeril, cyclobenzaprine, Xanaflex, tizanidine. Antihistamines, diphenhydramine, Benadryl, cetirizine, Zyrtec. COX-2 inhibitor, a non-steroidal anti-inflammatory drug, used to treat osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. For example, Celoxib, Celebrex. Smoking cessation, varenicline, Chantix, Champix. Vasodilators, clonidine, Catapress. Statins, anti-cholesterol, rosuvastatin, Crestor, atorvastatin, Lipitor, simvastatin, Zocor, Simvador. Analgesics, synthetic opioids, fentanyl, Duragesic, morphine, hydrocodone, Norco, oxycodone, OxyContin, Oxypro, Longtec, Raltibon, Zomastine, Percocet, Tramadol, Maxitram, Marol, Zydol, Zamadol, Tramulif, Tramquel, Ultram. Opioid dependence treatment, buprenorphine, naloxone, Suboxone, used to treat dependence on opioid, narcotic drugs such as heroin or morphine. Immunosuppressants, etanercept, Enbrel, adalimumab, Humira, methotrexate, amethopterin, prednisone, infliximab, Remicade. Diuretic, furosemide, uramide, Lasix, Discoid, and frusemide, hydrochlorothiazide, hydrodiaryl, Zyda. Dandelion, Pisonlee. Epilepsy and nerve pain, gabapentin, Neurontin, lamotrigine, Lamictal, pregabalin, Lyrica, topiramate, Topomex. Anti-inflammatory, ibuprofen, Nurofen, Brufen, Calprofen, Fenbid, ibugal, ibulev. Proton pump inhibitor. Lansoprazole, Prevacid, Nexium, Esomeprazole, Omeprazole, Losec, Mups, Pyrocalm, Pantoprazole, Protonix, Prilosec, Dantac, Ranitide. Hypothyroidism treatment. Levothyroxine, L-thyroxine, Synthoid. Type 2 diabetes treatment. Metformin, Axpinet, Diargimet, Gluciant, Leukophage, Metabet. Parkinson's disease. Parkinson's disease can result in tactile hallucinations, but the medications used to treat the disease can also cause hallucinations. Ropinirole, Requip. Antiviral, for example, ribavirin. Alexander Muachevek et al. Carus, 2020, August 12-8, Neuropsychiatric effects of antiviral drugs. The adverse events of antiviral drugs are dose-dependent and often reversible. The nervous system is often affected, and to date many studies have been published regarding the central nervous system toxicity of antiviral agents. They may cause significant neuropsychiatric complications, depression, psychosis, and painful peripheral neuropathy, side effects which may necessitate discontinuation of treatment. Illegal drugs. Drug-induced formication happens when a person uses various drugs with stimulant properties. Illegal drugs, once legal in this category, or legal drugs misused, include cocaine, methamphetamines, amphetamines, anabolic steroids, barbiturates. Marilyn Monroe died from barbiturates, and heroin. They once prescribed heroin for coughs. MDMA, methyl N-dioxy, methamphetamine, or ecstasy. Codeine, morphine. Mrs. Winslow's soothing syrup was once given to children. It contained morphine. Van Mariana was a wine containing cocaine and Bordeaux wine and sold as a patent medicine. It was created by a French chemist. Sniffing paint thinner. After reports about these hallucinations increased, the terms coke bugs, amphetamites, or methmites came to be used as well. Those with this problem also often experience scabs and sores on the skin, known as dermatosis. From the forum Totally ADD by Anonymous, May the 5th, 2012 at 1:05 a.m. Formication, the feeling of bugs crawling under your skin, is a common side effect of cocaine use. I remember when I was a resident, this guy came in picking at his skin, leaving these open wounds over his body, but would not admit that he was using cocaine. The ER doc was sure he was using it because the presentation was so critical. Now, remember I was in Pittsburgh. The ER doc called me in the wee hours of the morning to look at this guy. So I said to him, "You know, if you have some cocaine and put it in your shoes, this feeling will go away." To which he said, "Really? I have some." Whereupon he pulled out a bag of cocaine and began sprinkling it in his shoes. Diagnosis confirmed. The guy was such a bonehead. A number of illegal drugs are based on legal ones. For example, Lunesta is a legal drug, which is illegally sniffed. Brain damage. The following post, anonymous, was sent to WiseGeek, a question and answer forum for people who want help. In the playlist we have a video about seeing insects, as the symbolism is always used as a warning. WiseGeek, anonymous 278658, post 113. I woke up one morning, and as I was gaining consciousness, I could see some kind of bug, and it seemed to be totally aware of me, and seemed to be totally aware that I could see it. It crawled away and tried to hide. It was in my room and totally freaked me out as I awakened. It disappeared. However, over the weeks to come, it appeared again and again, and I became aware of more of them, and they became aware of me, and over the weeks to come, we seemed to develop a kind of relationship. It was freaky, because I couldn't see them until they got really close, but they would jump all over me, and on a subconscious level I could hear them speaking to me. They seemed to be all acting according to the instructions given to them by a single source, which was located in the corner of the room. They weren't threatening me, unless threatened. It was a really freaky experience at first. I have come to deal with the fact that they are there, even though at first I thought it was some sort of hallucination. I have actually felt their touch. They have bitten me, spat on me, and even tried to feed me, and I could taste what they put in my mouth. It still kind of freaks me out, but they are there. They cannot be seen by normal human eyes, and they freak out when you do see them. They look a little like lobsters. They're not threatening, but totally react to my subconscious thoughts, as if they could hear me. Weird or what? Many mental and neurodegenerative diseases can cause tactile hallucinations. For example, about 25% of people with schizophrenia suffer from tactile hallucinations. In a 2016 study, out of 200 surveyed persons with schizophrenia, more than 50% had experienced visual or tactile hallucinations. Those with manic depression, bipolar can suffer from tactile hallucinations, and see the description for the link. Alzheimer's disease also causes tactile hallucinations in many different forms. Parkinson's disease can cause tactile hallucinations, as can the medication for it. Stroke, Lewy body dementia, migraine, and epilepsy can all cause tactile hallucinations. In fact, all types of brain damage have the potential to cause tactile hallucinations, depending on where the damage has been inflicted. Phantom limb. Phantom limb sensation is feeling of a lost body part after traumatic injuries. It is often painful and a common experience among amputees. We described phantom limbs in our video of the template, as the person is able to sense the entire limb, whether it is an arm or a leg. But what may not be well known is that phantom breast pain can happen after mastectomy, in the same way phantom pains happen after limb amputations. Ramesh, Nutan K. Shukla, and Sushma Bhatnagar. Phantom breast syndrome. Indian Palliative Care, 2009, July-December 15-2, 103-107. Phantom breast syndrome is a type of condition in which patients have a sensation of residual breast tissue and can include both non-painful sensations as well as phantom breast pain. The incidence varies in different studies, ranging from approximately 30% to as high as 80% of patients after mastectomy. It seriously affects the quality of life through the combined impact of physical disability and emotional distress. Again, researchers are advising a diet free of pesticides, defoliants, weed killers, food additives, etc., and a mushroom and green tea diet.